I'm so fortunate to have Dr. Sunshine here, which I've been learning from him for the past 10 years. He's always researching, even if he's repeating the same presentation, I learn from him. So tonight we are covering some new stuff. If on your order form you don't see the products that you want to order, you can write it in, or you can come and ask me, I can write it in for you or give you. You don't need to write your address and credit card if you have ordered before, just if you're new. And on that note, I'm not going to keep you waiting. Dr. Sunshine.
Thank you. Got some feedback. All right. Can you all hear? Yes. Okay. Tonight's presentation is integrative approach to managing allergies, eczema, and skin health. In order to cover the subject, there's two major components of allergy. One is you have to understand the immune system, and the second one is you have to understand inflammation, because with allergies there's always inflammation, and it's always involved with the immune system. So what I'm going to do is cover briefly what the immune system is, how it works, and then we'll talk about inflammation, talk about the biochemistry of inflammation, to get you to understand how the products work. To me, it's always important to understand what's going on. That way, if you need to think a little bit during your practice, you'll be able to do it and come up with a good answer. So research is really the key to it, understanding the products. So tonight we're going to try to give you a good understanding of the products that are involved with these conditions. So the first thing we're going to talk about is the immune system. The immune system, if you could read your notes, the immune system is a very diffuse, complex system that is made up of cells, cell products, cell-forming tissues, basically to take care of foreign substances, foreign pathogens, to remove them, kill them if necessary, and remove them from the body. It has organs such as the thymus, the spleen, the lymphoidal tissues. All of those things are part of this system. So it's a very complex system. I'm going to cover just a little bit so you understand how the products work with respect to the parts of the immune system. So what is the function of the immune system? Basically, is to seek out and find things that are non-self. And the body has ways of doing that. The primary agents the body's looking for is pathogens, such as bacteria, viruses, fungi, and also defective cells and cancer. So the immune system is involved with taking care of these things, taking care of these cells. So these are some cells, and the body marks each cell with what's called a major histocompatibility complex protein. So every cell has one of these on it. And what that does is the white blood cells, as they're coming through the body, looks for that. If you don't have one of those little markers, the cell will be destroyed. And so that's basically how it works. So we need to know about those. So an antigen is a non-self substance that will elicit an immune response. And basically, if you think about it, when I learned initially, I thought that the body knew what a whole protein was. It says, okay, this protein is foreign. That's not what happens. Only a portion of that particular protein is actually what we call the epitope. That's the thing that is the immune trigger. So cells, this is quite amazing to me, cells actually display, this is a viral infected cell, and on this major histocompatibility complex, it displays an antigenic peptide, which is the epitope. So how would a white blood cell know that this cell has a virus in it? The only way it would know is if it could get inside there and look, but it can't do that. So what it does is it comes by and sees this antigenic peptide from the infected cell with the virus in it, and will then stimulate the immune process. And there are several different parts that we'll talk about. There is an antigen-presenting cell, which also will display these antigenic peptides, and these are basically dendritic cells and macrophages, and they will display those, and we'll show you how that works in just a second. But before we do that, these are the cells in the immune system. They come from where? They come from the bone marrow. And there is a stem cell, basically, that starts out, a hemopoietic stem cell, which comes down and divides into a myeloid progenitor and a lymphoidal progenitor. The myeloid progenitor, what it stimulates the production of basophils, eosinophils, macrophages, megakaryocytes, which make platelets, erythrocytes, which are red blood cells. So that is the myelogenic side. The lymphoidal side is T cells and B cells and dendritic cells and natural killer cells. So there are two sides to this. There's also two sides to the immune system. The immune system has an innate immune system, which is one side, and then the other side is the adaptive immune system. And this explains why certain things happen that you have a cold in 7 days, it's gone. Because it takes that long for the body to mobilize one side of the immune system, the adaptive side of the immune system. So the innate side is pre-programmed, it's inherited from your parents, and basically handles common threats. And the cells that are in there are basically your eosinophils, your basal cells, your macrophages. They're all part of that. Dendritic cells are involved. And then the adaptive one, that develops as we go into the world and we start becoming in contact with bacteria and viruses. The body then develops the cells to actually kill these things. And they take care of what the innate immune system doesn't do. The innate immune system is very quick. It's rapid. It responds, it just sees whatever's there, goes, looks for the major histocompatibility complex, sees where it is, it's not there, it attacks the cell. It's very quick, limited specificity, if any, other than you're not me, okay? So therefore I'm going to attack you. No memory. On the other side, the adaptive immune system develops slowly, 7 days. Okay, it'll take 7 days for it to fully develop because there are several processes that go on. It's very specific, highly specific, and it has a memory. Once you stimulate that and produce a T cell or a B cell, the body knows that from then on. You have that same bacteria, that same virus, kills it immediately. That's immunity. And that's why, for me, it's so important for kids to get in the dirt. Everybody wants to say, we got all this hand stuff and we're killing germs, and germs are like, we have a phobia about germs. The only way you develop your immune system to the adaptive part of it is to experience infections, experience sickness. So without having that, you're not going to have it. So my kids, basically, we just let them go. And we took care of them. And we didn't need a bunch of medication necessarily to take care of them. And, because God provided with us a lot of things that actually work. So the antigen-presenting cell, and the reason we got this slide is the antigen-presenting cell actually finds the antigen out there from the sick cell and will release cytokines. And this one here is IL-12, and this is very important because the body communicates, the white blood cells communicate with each other chemically. and there is a number there. I think they're up to 39 cytokine or interleukins now, which are cytokines. And the communication is chemical, back and forth. So when the antigen-presenting cell takes in the epitope, it processes it, and it will send out either an IL-12, IL-1, or tumor necrosis factor to stimulate the body in the adaptive immune system. This is not the innate, this is the adaptive. So here's the antigen receptors. This is a B cell. We'll talk about B cell. B cells make antibodies. That's what they do. They're part of the T cells, or part of the lymphoidal cells. So a B cell makes antibodies. Here is a antigen-presenting cell presenting the epitope to this B cell. What happens, and we'll show this whole process, it's going to stimulate that B cell to become a plasma cell, which then makes antibodies. So there are specific receptors. Now, this receptor on the B cell the B cell already knows that that's what its job is. If that ever shows up in town, I'm going to kill it. Right? So it already has that receptor. The antigen presenting cell present it, boom, the process goes on. This one here is a natural killer cell. This is a T cell. And if you look in the literature, CD8s, if you ever read studies, it talks about CD8s and CD4s. CD4 is the T helper cell. CD8 is this one here. Here's a CD8 protein. That is a natural killer cell. It's a T cell that will kill a infected cell. So it has, again, the same antigen receptors and the epitope. T cell also, T helper cell. So once the antigen presenting cell releases the cytokines, sometimes it's IL-2, sometimes it's IL-4. Here's IL-12. That starts the process. This is a native T cell, and this is a Th1 and Th2. If there is IL-2, it's going to stimulate Th1, and we're going to talk about, the reason I'm talking about this is one of the products that Quality of Life has stimulates this side of the immune system. And this side of the immune system is a cell-mediated response. This is where the cells go out, natural killer cells, to kill whatever is there. This side is the humoral side, is the antibody side. This side is primarily more allergy, and that's what we're going to talk about. So you need to know that when allergy is flaring up, this side is involved. Well, Quality of Life has a product that will stimulate Th1 cytokines. And when it does that, there's a seesaw balance between these two. If, in this case, this is a B cell virus, what is a B cell virus? A B cell is an immune cell. And who hides in the B cells? What virus hides in the B cells? Epstein-Barr. Epstein-Barr is what causes what? Mono. Okay. Epstein-Barr hides in the B cells, and so that the body doesn't even know it's there. So this is a B cell virus. What does it do? It blocks Th1. What does Th1 do? It attacks cells, attacks viruses. So by stimulating the B cell, stimulating this progression, it's going to actually block this one. Vice versa. If this is stimulated, which we're going to show you how that works with something called QOL, which is a fantastic new product they have, it stimulates this side of the immune system to have this one go down, this one go up, and guess what? Your IgE goes down, your cytokines go down, and it modulates the immune system naturally, no side effects. Okay? That's the last one we'll talk about, but I'm telling you this so that when we get there, you remember. Okay, so here's a B cell, here's an antigen, these are the epitopes. The B cell is already sensitized, and it sees this epitope. It starts to process that. It displays it here. An active T cell comes in, they touch, releases cytokines, it's made into a plasma cell, and then antibodies. That takes time. sometimes 7 days. That's why you get a cold and it lasts for 7 days. Right? That's why the incubation time for things is 7 days. Okay? The earth was made in 7 days is an important number. Right? So it's slow, but it works. So here now we'll talk about allergy. If this B cell stimulated by an allergen comes in to make a plasma cell, it makes IgEs. These attach to mast cells, and the mast cells sit there, and if an antigen comes in that fits in that space, it releases its granules inside, which has what in it? Histamine. So histamine is released, leukotrienes, and a number of different active products. So, type 1 mediated hypersensitivity. This is the first type of hypersensitivity, IgE reaction, very quick. Releases histamine. What does histamine do? Histamine constricts smooth muscles, constricts bronchioles, causes wheezing, causes constriction in the intestine, so you get cramping, diarrhea. It dilates, and we'll talk about this. It does vasodilation to increase fluids in the area. That's why when you have an allergy, your nose is stuffy. You also have runny eyes, itchy eyes, all from the same thing, histamine release. So what do we have? Lots of antihistamines out there that they give patients. Okay? And there are some natural ones. They also release leukotrienes and prostaglandins, which we're going to cover because they're very important. They're involved with inflammation. So what is an allergy? It's an induced immune-mediated inflammatory response to internal or external antigens. So notice it's an immune response and it's inflammatory. That's why we have to talk about the inflammation. So you have to understand how inflammation works. So what is the function of inflammation? To bring effector molecules and cells to a particular area where something is going on, tissue injury. Okay? Also to wall off that area, form a physical barrier, and also heal the wounds. So inflammation that we're talking, oh, I've got inflammation. Inflammation is good, okay? Because it heals you. You get a cut, you get a break. Without inflammation, you're going to get pathogens in and you may die. So inflammation is good. Too much inflammation is not good. All right? So let's talk about it. When we do get injured, there's an immediate vasoconstriction. In other words, the blood vessels constrict. Why do they constrict? To prevent you from losing more blood. This is only temporary. Followed by vasodilation, in which the blood vessel starts to expand, the smooth muscle relaxes. When the smooth muscle relaxes, what happens is that blood vessel expands, everything slows down. Normally, if you've ever seen pictures of blood flowing, it's flying by, cells are flying by, okay? When this happens, it opens up, all of those cells start to marginate. They start to go to the outside of the blood vessel. Why? Because they're going to get out and fight what's ever there. So they have to marginate, and then they also have to adhere to the lining of the blood vessel. So I like to think of it as Velcro. You know, Velcro has two sides. The adhesive molecules are on the inside of the endothelium in the cell, in the blood vessel, but they're also on the white blood cells. And I had a nice slide of it, you know, but there's not enough time to go through it. But it's really cool. You can actually see the white blood cells stop, sneak out. Okay? That's also facilitated by vascular permeability. The histamine does a number of things. The one thing is we talked about, but it causes the cells to actually shrink. The actual endothelial cells shrink because they have an exoskeleton, and it shrinks. When it shrinks, they separate. So there's a space. So guess what? The white blood cells go through that space. Other things go through that space. So the closed junctional borders are diminished or expanded to allow that to happen. So then you get an influx of the phagocytic cells that help clean up the mess. So what is the result of this? Rubor, which is what? Redness, because you got more blood in that area, so it turns red. Tumor, which is swelling because there's more blood, there's more tissue. Kalar, because it's there, it's heated up. And pain. Those are the 4 common signs and symptoms of inflammation. So that we talked about the cell activation, neutrophils, monocytes, and lymphocytes, and this is the mediators. And we're going to concentrate on this one right here because they're very important, and the products that we have actually attack these different places. So you need to know about it. Number 1 is vasoactive amines. We talked a little bit about histamine. We'll talk a little bit more. Plasma proteins, this is the clotting mechanism. We did that when we covered the cardiovascular disease. Arachidonic acid, this is very, very important. These are eicosanoids, platelet activating factor, nitric oxide, all of these other things. We're not going to talk about. These 2 we're going to talk about. So histamine causes vasodilation, venular endothelial contraction, so it opens up the wide junctions. Where does it come from? It comes from trauma and injury. It comes from IgE and mast cells. We talked about that. The IgE attaches to a mast cell. When an antigen comes by and attaches to that, it releases it. So serotonin actually is a vasodilator. We're not going to talk about that. Let's talk about my favorite subject, eicosanoids. Eicosanoids are very important. These are essential fatty acids. What are essential fatty acids? They're fatty acids that you cannot make. Okay? Fat is composed of glycerol and 3 fatty acids. All right? So the fatty acids that you have to consume are the ones you can't, and those are essential. The two major ones that are being banded around a lot, omega-6 and omega-3. What that means is omega-6, a fatty acid is a chain of carbons. One end is omega, the other end is carboxyl. The omega end, if you start at the omega end and you count the number of carbons to the first double bond, whatever that number is, that's what it is. It's an omega whatever. In this case, these are omega-6s. So there are 6 carbons between that one end, the omega end, and the first double bond. There can be multiple double bonds, whatever. Omega-3s, there are only 3 carbons. Now these 2 are extremely important. You really need to be paying attention to these with your patients because these guys are pro-inflammatory, not all of them, these guys down here. Pro-inflammatory, pro-blood clotting. So if you want to prevent cardiovascular disease, you don't want a lot of these guys. And guess what? The American diet is what? You know, it should be 1-to-1, omega-6 to omega-3, and it's probably 30-to-1, maybe. Okay, depends what you eat. All right, so it's very important. So arachidonic acid, we're going to talk more about it. This side here, well, where do you get these? They're oils. Corn oil, vegetable oil. Okay, all of those oils, they're all omega-6. Okay, so they are not productive for inflammation. They're going to increase it. These guys are what? Fish oil, krill oil, chia seed oil. There's a zooplankton called what? Krill. Okay, so that's what these are. And I'll make one caveat. These guys down here are the important ones, EPA and DHA. They're all important. Alpha-linoleic acid. What they fool you is to say, you know, I get eggs and it says, okay, there's X amount of omega-3. And everybody wants omega-3 because they know it's better than omega-6. Okay, so if it's ALA, this is a 16 carbon versus this is a 22 and 20 carbon. These are the ones that make your brain work. These are the ones that do all of the anti-inflammatory stuff. So if I get eggs that have omega-3s, guess what they have? They have ALA. They don't have EPA or DHA. Where do you get the EPA and DHA? Fish. Where did the fish get it? Plankton. Yeah, the fish doesn't make it. You think, wow, that's cool. That fish made that omega-3. It ate algae, plankton. And that's what makes it. So what we need is a big farm of plankton to make it instead of eating the fish with the mercury. But anyway, we can go there. So these are anti-inflammatory and very, very important. Let's talk about the bad guys. These are the good guys. This is prostaglandin prostaglandin E3, prostaglandin E2. This is a bad guy here, and so is this one. So what happens, how are these things released? This is an IL-1, interleukin-1, stimulates an interleukin-1 receptor, which in turn stimulates phospholipase A2. Phospholipase A2 breaks off arachidonic acid. Guess what? Arachidonic acid is in the cells of your body. So when you have tissue damage, it releases arachidonic acid. You also get it from diet. But arachidonic acid, this is the real crux of where bad stuff happens. What is COX? COX is there. What is that? That is an enzyme, cyclooxygenase. And this is what goes down through this pathway. It comes down, arachidonic acid comes into prostaglandin H2, and then the thromboxanes and all of these pro-inflammatory. If it goes the other way, that's leukotrienes. Okay, leukotrienes are lipooxygenase. The other ones are cyclooxygenase. One is a cyclical pattern, the other one isn't. Now, what does all this mean? Well, here's your prostaglandins. And the first one we're going to talk about first product is Allersol. And what does Allersol do? Number one, it blocks the phospholipids being released from the membrane because it blocks phospholipase A2. Second thing it does is blocks COX. There's two real COX, COX-1 and COX-2. And this is where what is a COX medication? COX-1 or COX-2? Aspirin. It's a COX-1 inhibitor. Okay. If you have high quantities, it actually works as COX-2. Also, here's arachidonic acid. Here's lipooxygenase, makes leukotrienes. Now they have an interesting ad on one of the medications, and it says we don't just block histamine, because a lot of drugs block histamine. So there's a lot of antihistamines. We block 6 different things that create the allergic response. Well, one of the ones they talk about is leukotrienes, because they modulate this inflammation and thromboxane. So they block that. That is the molecular level. We're going to go down into the genetic level now. Okay? And we're going to show you what products that we have that works with this. This is the main protein, nuclear factor kappa B. It's the main protein complex transcription molecule. It's a bunch of words. Basically, it helps you make proteins inside the genes. And this is the guy, this is the one that is involved in it. And it is very, very important. It's stimulated by cytokines, stimulated by UV light, free radicals, oxidized cholesterol, LDL, bacteria and viruses. It is a key regulator in the immune response for infection and inflammation. And the way it does is it actually regulates the genes working. You have inflammatory genes that make inflammation with inflammatory proteins. Okay? So we want to maybe block this guy, and when it isn't being blocked and regulated correctly, cancer, inflammation, autoimmunity, and viral infections increase. So if you're not modulating this, it's a real problem. So here he is. This is the signals coming in, and this is a NF-kappa B that is blocked by that little product right there. These things stimulate the removal of this phosphate group, and this is actually NF-kappa B here coming down, picks up a cofactor, RNA polymerase, goes to the DNA, and makes a protein. And that protein is what causes inflammation. The problem with it is it's self-perpetuating. Once it starts, it doesn't stop unless you stop it. And that's part of the problem. So what stops it? Curcumin and Resveratrol. Quality of Life has two great products that will block NF-kappa B. Curcumin and Resveratrol SR, both of them. So we'll talk about them. But the first product now, we're going to go into the products and then sort of fit this into where it should fit. This is Allersol. It's Allerinol Peril Frutensis extract. That's a big mouthful. It's a Japanese herb. It has that in it. It has quercetin, it has bromelain, and it has nettle root. That's what it's made out of. So we talked about the allergy. It's a hypersensitive reaction. Immune system makes antibodies. We covered that. Histamine release. So what does Allersol do? It supports sinus health, respiratory health, and relieves itchy eyes. So there are a number of studies. These studies, as Beta said, you can find in www.humanclinicals.org. I have this at the end of the program. You can write it down if you don't have it. But it has all of these studies in it. So this is a randomized, double-blind, placebo-controlled study with this Japanese herb with itchy eyes and an allergic reaction. This is environmental. And what it does is it reduces those symptoms because it reduces inflammation, and that's how it works. Bromelain. What is bromelain? Don't all yell at once. What did you say? Yeah, it's made from pineapple. And it is a group of proteolytic enzymes which will relieve nasal inflammation and improve sinus health. So that's in the product also. Supports respiratory health, a double-blind study with bromelain, okay, reduced compared to placebo, 83% to 52%. And that was in the Headache Journal. Eye irritation, double-blind study with they had watery eyes. It was reduced, and this was as a result of quercetin, okay, which is a bioflavonoid. It reduces the ocular scores. So there's ample proof that it works. So this is a patient, okay? This is one of our patients. This is actually Dr. Beta's patient. She came in, she's a 55-year-old female suffering from skin allergies for 10 years, not able to sleep from rashes that lasted 4 to 6 weeks, and it would blister up. She was unable to sleep because she was constantly itching. She had taken antibiotics, steroids for 5 years. No real results. She still had a problem. It still lasts 4 to 6 weeks. Dr. Beta saw her on March 2015, told her to take 2 Allersol 3 times a day and 1 Biflon. We'll talk about Biflon, it's a probiotic. One 3 times a day. 1 week of these 2 products, basically food-based medicine, she saw some improvement. Well, here she is. Okay? And you can see her face. I don't know whether you can see it. Can you see it back there? Okay. There she is 1 week before she started taking it, 1 week later. Wow. Pretty amazing result. Okay. That was Allersol and Biflon. Biflon, and we'll talk about it, it's a probiotic. Probiotics are very, very important with allergies. If you don't take care of the gut, you're going to have more allergies. Okay, you're going to have leaky gut. You're going to have stimulation of the TH2 pathway because of the cytokines. So it's very important to take care of the gut while you're taking care of it. So here's what Allersol does. It blocks these. We talked about this. The COX, the PLA, inhibits this. And here's another one here. This is Neptune Krill Oil. This is omega PL. It blocks leukotriene production. Allersol also blocks lipoxygenase. So it actually attacks both sides of it. Meriva Curcumin. Curcumin is from what? Turmeric. I remember when we first started studying turmeric, you know, and curcumin, always got it mixed up with cumin. Separate thing. Do not eat a lot of cumin and hope that you're eating curcumin. Okay, totally different. Meriva Curcumin was made because a lot of the botanical products are not well absorbed. They're very big. Okay, one of the problems is they're large and they're not absorbed well. So what they did with Meriva Curcumin, it's a patented form of curcumin, which enveloped them in a soy base, phospholipids. Your membranes are phospholipids, so anything that's phospholipid can be absorbed much better because it's the same thing as the membrane, so it's going to penetrate the membrane easier. So that's what Meriva Curcumin, placebo-controlled study with Meriva Curcumin on osteoarthritis. It's amazing. Curcumin will work for osteoarthritis. It'll also work for rheumatoid arthritis. All right? And, well, I'll talk about it a little bit later. It will work on ulcerative colitis. All right? We have people in remission with ulcerative colitis taking a specific curcumin that is made by Quality of Life. So the WOMAC index is Western Ontario McMaster's University Arthritis Index score. Was reduced by more than half the walking distance. They could walk 3 times more. The biochemical markers of inflammation decreased. So curcumin does a lot of things. I mean, it's critical in my practice. It reduces joint pain with rheumatoid arthritis, decreases cholesterol triglycerides with heart patients, improves endothelial function, relieves pain from surgical. So it's a good painkiller. We have it in combination with other things. It's important in helping oral conditions such as leukoplakia and lichen planus. Those things, nothing helps. If you know anything about them, they're hard to treat. Relieves eye uveitis. That's the the middle layer of the eye. Reduces inflammation in diabetics. So curcumin is really important. It's anti-cancer. If a cancer patient, if they're not, curcumin is really important in treating. And it's an adjunct, unless it blocks the chemotherapy. So you've got to understand, some of them will actually block it. Actually, what they're trying to do with the chemotherapy is to destroy tissue, and what curcumin does is protect tissue. So sometimes you've got to be careful that you're not knocking out the chemotherapy. Curcumin has shown excellent anti-inflammatory properties, both in animal and human studies. The problem with it is you can't absorb it. My wife got breast cancer, and I was looking up what we could do with curcumin and turmeric in order for her to take the quantity that was necessary to improve the breast cancer situation. You had to take 30 pills a day. You can't take 30 pills a day. You shake them and they rattle. Okay, so that was not good, and it was this bioavailability problem. So what curcumin SR is a sustained release curcumin. They do 2 things to it. They micronize it. They take it in a process and grind it up, basically. They grind it very fine, and then they hook it into a matrix that is a time-release matrix, so that you get a prolonged release of curcumin rather than just a blip and then gone. So clinical research shows that curcumin SR is absorbed faster than regular curcumin, 8 times more bioavailability than regular, and it has a sustained release for 9 hours. Okay? The peak is reached in 2 hours and remains there for 9 hours. Regular curcumin takes 4 hours to get there, and by the time it gets to 9 hours, it's nothing. So it's done by micronization, which I talked about, and then hooking it up with the specific polymers to release it slowly. Resveratrol. Same problem with resveratrol. Therefore, we have a resveratrol SR. Resveratrol is very important. It improves insulin sensitivity, very important in diabetics. It mimics, one of my favorite things, it mimics caloric restriction. If you restrict calories, what happens to you? Well, you lose weight, but you live longer. It's known that people who restrict calories will live longer. Well, what if you could take a pill that would mimic caloric restriction? And that's what it does. So the result of that is it lowers liver fat stores, so fatty livers. It improves blood sugar levels. It reduces triglycerides, decreases inflammatory markers and systolic blood pressure in obese patients. So it's a pretty good little thing to do. Do I do it? Yes. Do I take that? Yes. I figure I need to be around for much longer, so that's what I do. Circulation is improved. Cerebral circulation helps cognitive function. It reduces reduces generation of free radicals, reduces inflammatory markers, and is important with insulin-like growth factor. Insulin-like growth factor, something that looks like insulin and causes growth. So what does that do? That's involved with cancer. Cancer loves certain things. What does it love? Sugar. It's got 16 times more receptors, insulin receptors, than a normal cell. So it gobbles up all the sugar. So it's just sugar thing. What else does it like? Cancer. No oxygen. It's anaerobic. Doesn't want oxygen. Okay? What else does it like? Blood supply. All right? You need blood supply. So angiogenesis is really important. And it likes growth factors. They stimulate the cancer production and the metastasis. It's very important. So resveratrol takes care of that. It's got the same problems. It's poorly absorbed. Have to take large doses. With micronized and the extended release matrix, you can get it much more readily. 2.5 times greater bioavailability. Sustained release, 9 hours again. That's really critical because most of them, you watch the blood levels, goes up 2 hours, is up there, and it's dropped down within another 2 hours, it's gone. It's not working. So going back to, and I didn't say about it, I talked about ulcerative colitis. We had people who were given their curcumin without the extended release. And I had several ulcerative colitis patients, and they were able to get off of their Remicade, and they were able to do that by taking a specific curcumin. And when they ran out of it, they bought another curcumin, which didn't work, and then they bought another, and they even bought Meriva Curcumin, and it didn't work. What we found was that the curcumin SR was the only one that worked. Now, I don't know why that is, other than maybe because of the fact that it's there longer, but that's the only one that works. And we've had people in remission for 7 years, 6 years, by taking that without having to use the biologic agents. Metasol. Metasol is a low molecular polyphenol from lychee fruit and green tea extracts. Anybody know what lychee fruit is? I didn't know what lychee fruit was. I actually went to where they make Metasol and where they make the products in Japan, Beta and I, and one of the people there, he says, "Oh, you got to eat this lychee fruit." Well, it looked like a little pod. It looked like a little old-time helmet that they used to wear when they played football. And I thought, he says, "You just peel that out, and it's white. Don't eat or touch, don't get anywhere near the pit because it tastes terrible." So anyway, I did that, and boy, That's the greatest stuff. I mean, so I went down every morning to get the lychee fruit. And they also did something else which was pretty interesting. They put mango juice and apple cider vinegar. I would have never thought that would taste like anything. I read that, and it is really good. You got to mix it correctly, but it gives you a little bite at the end, and it's delicious. So the last day we were there, Beta and I, we were. I got up and went down. I'm going to eat the lychee fruit. It was, I don't know, what is it, Sunday or whatever. There was none left. So I had to go home thinking about eating lychee fruit. So lychee fruit is a polyphenol, okay? And is a high molecular weight polyphenol. High molecular weight. Can't be absorbed. Okay, well it can, but not very well. Polyphenols are really important. There are big studies on them in the University of California. They're found in green tea, chocolate, wine. The absorption of them is 30%, 10 to 30%, but the Amino Up Chemical Company has a proprietary process that allows it to be absorbed 3 times better. This is a great product. It's called oligonol because they oligomerize it. What basically that is, this is a polyphenol, can be 500 Daltons. What they do is they break it down into monomers, these little guys here, okay? Monomers, dimers, and trimers. This is better absorbed because it's 5,000 Daltons. So it's better absorbed, it's quicker absorbed, and it's more bioavailable. So here's some of the other types. Here's oligonol, okay? Look how many monomers, dimers, trimers, and these are above three of those. And here's lychee fruit. See where they are? Way down here. And then pine bark, pycnogenol, grapeseed extract, they got nothing, virtually. Here it is. This is oligonol, okay? 2 hours absorption. Here's the other one. 3 times higher absorption. Okay, look at it, lasts longer. Pretty amazing. It's a great product. I take it every day. Polyphenol concentration 3 times, we said that. All right, so what does it do? Okay, this is one that has a lot of properties. It inhibits inflammatory markers after physical exercise in sedentary males. We don't have any sedentary males in here, right? Okay, all right. But if you were, you would have less problems if you take Metasol. I take it twice a day, but I'm not sedentary. It reduces uric acid levels. What does that help? Gout. So we have gout patients. If we have gout patients, one of the things we're going to give them is oligonol. Or Metasol. It reduces visceral fat and improves insulin resistance. And we have some slides where it has reduced belly fat. Okay, we're not talking subcutaneous fat, belly fat. All right, 30% in 8 weeks. Not doing anything else. That's impossible. I have a friend of my son who's involved in that biochemistry, runs 2 labs, and he looked at the results. He says, that's amazing. I've never seen anything like it. So, yeah, if you want to get rid of belly, it produces adiponectin is how it works. Suppresses postprandial hyperglycemia in males, those with elevated blood sugar. Why do we care about that? Postprandial means after eating. Why do we care about those spikes? Those spikes are what causes you to deposit sugar in your tissues. It's called what? Glycation. So when you glycate your nerves, you get what? Neuropathy. When you glycate your arteries, what do you get? Arterial sclerosis. So sugar sticks to protein. Sugar sticks to protein. If you didn't believe that, go to the Krispy Kreme factory, okay? And you watch the donut going down the little, and all of a sudden this thing comes and goes, and now it is a glazed donut, okay? Sugar sticks to protein. When it does, it denatures the protein, and guess what? You have problems. The other thing, let's see, Metasol. The other thing it does is increases nitric oxide. And I talked to somebody today and he was telling me that gave this to their patient and they had Raynaud's disease and he gave it to them and then they didn't have Raynaud's anymore. Okay. It will do it, and when we cover it in detail, we'll show you the thermograms of the blood flow coming into the extremities. So it's good for that. It was the Nutracon top evidence-backed product of the year in 2008. Neptune Krill Oil is called Omega PL in quality of life. Neptune Krill Oil is an omega-3, EPA DHA, it has phospholipids, and it has astaxanthin. So krill oil is a zooplankton. It inhabits Antarctica. It has, the difference between it and fish oil is that the EPA DHA, the essential fatty acids, omega-3s, are attached to a phospholipid rather than a triglyceride. Triglyceride is fat. This is a phospholipid. This is what makes up membrane, so therefore it's absorbed faster. As a matter of fact, 91% bioavailability compared to 65% with fish oil. It is better in reducing cholesterol and triglycerides than fish oil. It has 48 times greater antioxidant power because it has astaxanthin, which is an antioxidant. It's not fishy. It is checked for PCBs, and they screen that out, and it's bioavailable, sustainable. So it's a pretty good thing. Here's a placebo-controlled study. They compared 1 gram of Neptune Krill Oil, or Omega PL, with blood levels in hyperlipidemia. It reduces cholesterol 13.4%, LDL 32%, increases HDL 43%. That's a lot. Reduces triglycerides 11%. All of those are more significant than fish oil. Bifalon. We already talked about Bifalon. Bifalon is a probiotic. This is what this woman took who had the skin problem. So human ecology, this is the biggest subject right now, the human biome, okay? That's the gut bacteria. Very, very important. All your body surfaces that are in contact with the outside world have colonization of bacterial fungi on it. You have natural symbiotic bacteria and fungi. Normal flora are those microbes that live in a symbiotic relationship, cause no harm. These things vary tremendously. Your diet, what you eat in one meal can change your microbiome. Lifestyle, you know, you smoke, you drink, what do? You exercise. The environment, blood chemistry, all these things impact the microbiome. And the microbiome is communicating with your brain. A lot of the hormones are made in the gut. A lot of the neurotransmitters, in fact, more neurotransmitters are made in the gut than in the brain. Serotonin, for example. So when this goes awry, we have dysbiosis. This means not working right, and biosis means the wrong bugs. So you have damaged microflora in the gut. You will get damaged wall. The microvilli will be destroyed with dysbiosis. Causes leaky gut. Basically, leaky gut is the gut, those closed junctional barriers open up. Stuff gets through, not supposed to. What does it do? It goes to the bloodstream. The bloodstream picks it up. This is foreign. It makes it into an allergen. Or it stimulates type, which one? 2 hypersensitivity reactions. Okay? The Th2 pathway. So what causes it? Prolonged stress. Why is that? You have cortisol. What does cortisol do? Decreases secretory IgA. What is that? That's your immune system in your gut. Basically, your gut, what's inside there is not you. That's outside. Everybody thinks it's inside. Really, it's outside. So your body has to protect you from that. Okay? You don't have skin in there, and you're absorbing through there, so how does it protect? It protects it with actual immune secretory IgA. So if you're stressed, guess what? Cortisol decreases secretory IgA. Cortisol decreases the mucus layer that protects your gut. Decreases the microvilli. So being stressed out all the time, it's a problem. Cooked oils and fats, they become rancid, okay? They become trans fats, high sugar, sodas, alcohol, NSAIDs. You don't think about NSAIDs, causing ulcers and stuff. Antibiotics, pain relievers, eating habits, radiation and chemotherapy cause dysbiosis. What do probiotics do? They resist colonization. You don't want those bugs to colonize in there. So what the good bacteria do is prevents that. Antimicrobial polypeptides are released. These are substances that kill the other bugs. You get candida, what do you give a patient? Saccharomyces boulardii. What is that? It's a yeast that makes a chemical that kills candida. You can give them diflucan too if you want. Inhibition of pathogen adhesion, production of antimicrobial substances, degradation of the toxins, stimulation of the peripheral and local immunity, brush cell enzymes. These are all stimulated by good bugs. Here's your secretory IgA is enhanced, and it prevents translocation, getting the bad bugs out. So here's what, this is good effects of probiotics. And this is bad effects of probiotics. Good probiotics make vitamins. They actually make the vitamins in your body. They improve the intestinal environment. They prevent infection. They support the immune system. And if you look at these lines from these different genuses of bacteria, there's only two that go to all of these. And that's Bifidobacterium and Lactobacillus. If you look on this side, you don't see that those bacteria doing any of these things. Intestinal putrefaction, microbial toxins, production of carcinogens, and pathogenicity. That's what all the rest of them do. So you want to prevent these things from happening. It's very important to have the right microbiome. So here's Bifidobacteria, okay? And this is at birth. Look what's there at birth, the day of birth. This is what's in your gut. Bifidobacterium, Escherichia coli, and Lactobacillus, those three. As you get older, Bifidobacteria starts to go down, and these other guys go up. Okay, this is when you're almost dead. All right. So here's a study. This is what a 3-month-old has. This is, the green is Bifidobacteria, 10%, 90%, and then all the rest are 10% at 3 months. This is what happens as far as putrefaction. Ammonia, indole, phenol are all produced very minor in this situation. When you go to this situation when you're 24, look at the difference. That's how much Bifidobacteria you have. So guess what? I take Bifidobacteria, longest. BB 536. Why? Because I want to be a baby. As a matter of fact, they actually took baby poop and figured out what the actual bacteria were in there. And then they patented the product. Oh, it's super. Let's talk about it. 25 human studies, animal studies. It's the most stable probiotic in the world. The stability is similar to, the stability and similarity to the infant's digestive system. They took it from the infant's digestive system. Number one selling probiotic ingredient in Japan. So here it is. This is a study on when you take an antibiotic and get diarrhea. This is what happens when you don't take Bifidobacteria, and this is what happens when you do. Decreases the diarrhea. So while you're taking antibiotics, Bifidobacteria is a good one to take. This right here is its longevity, we'll call it, 36 months. Shelf life, 80%, 36 months. Okay? 3 years. Compared to 24 and 18 for the other products that were tested. So it's a great probiotic. We're to the end, folks. All right? This is Eczema. This is the new product. This is something I've been experimenting with our patients. It is 2016 Better Nutrition Best Supplement Award winner. Okay? And what does it have in it? What is it? It's Lactobacillus L92, a specific strain. And what does that strain do? Stimulates Th1 modulation of Th2, reduces allergy. How many of you patients have atopic dermatitis? How many patients you have with it? Very difficult to handle. Drugs or whatever. All right? This product will help with that. And I have some patients on it. Healthy people even, it causes a dry, smooth, and sensitive skin and improves appearance. But it's because of the cytokine modulation that I talked about. Atopy is the term for a genotype to have a predisposition for local anaphylaxis. That's what happens with atopic dermatitis. Local outbreaks of anaphylactic reaction. What's an anaphylactic reaction? It's an IgE reaction. Okay? Increase the eosinophils. This is all about, I'm going to let you read this, but basically, I talked about it. It increases Th1 and decreases Th2 dominance, and that's the allergic response. So here's some studies. These are all in again, the human clinical. Archives of allergy and immunity, lactobacillus, the symptoms, what was the topic, what were they doing it for? They were seeing what it would do with atopic dermatitis. And this was done, and the concept, of course, being the Th1 increase and decrease of Th2. And what they were doing it with in conjunction with medical treatment. They significantly improved the medical treatment with it, with this product. While they were taking steroids and steroid creams and topically. So it actually improved it significantly. And the reason is this modulation of the immune system. This one here is fermented milk on cedar pollen allergies. This goes for any allergy. This is a cedar pollen allergy, it's an IgE allergy, and it's modulated by this particular strain of bacteria. And when I first looked at it, I thought, wow, that's a probiotic. They kill it. They actually kill it and put it in stuff. So it's not even, some of it is alive, some of it isn't. You can do it either way. And the reason is, what happens is, this goes into the gut and it stimulates what's called toll-like receptors. And a toll-like receptor is what pushes this whole pathway. If you were in, for the discussion we did with immunokinoko, that's how it works to improve the whole immune system. It stimulates the gut receptors, basically making the body think that it has an infection. And when it does that, it ramps up this Th1 side. And that in turn brings down the allergy side. So that's how it works. 90 billion colony-forming bacteria. Improve the, and it was in the milk media, improves the cedar pollinosis. This one, yeah, that's the same one. Conclusion, it significantly helped them. And this was the last study, okay? Again, with atopic dermatitis, they found it worked well with kids, so they tried it with adults. And guess what? Same results. Improved the function. We have it with kids. I have it with, give it to children who have eczema. Improvement, a major improvement. A gal came in and says, look at my kid. She's 3 years old. She's never had skin like this. Just taking one capsule a day. It's amazing to me. But I understand why it works. And that's what you should. And so you can use this in conjunction with, if the doctor's given medication, it can be used. It doesn't interfere with anything. So here's humanclinicals.org. You can look up the quality of life products in that. And that's it.